Some senior executives at health trusts in the West have received big increases in their pay this year, despite the freeze imposed on most NHS staff. The figures have been obtained by BBC Points West. The increases of up to 5 times the rate of inflation have been condemned by the organisation, which represents nurses. Here's our health correspondent, Matthew Hill.
This has been a year of protest by unions at the prospect of regional pay in the NHS. And despite a recent government announcement that they were against the whole idea,
this means continuing with national pay arrangements in the NHS and prison service.
The consortium of hospitals and healthcare trusts behind the plan say it's still under discussion. Most NHS staff are also on a 2-year pay freeze, but for some of their bosses it's a different story.
Well, while most chief executives' pay in the region has been frozen, there are some exceptions. For instance, the man in charge of the Somerset Partnership NHS Foundation Trust, Edward Colgan, is now paid between £130,000 and £135,000 a year. Now that's £10,000 more than the year before. His trust says that increase is to reflect additional responsibilities of taking over community health services. The man in charge of the Gloucester Hospitals NHS Trust, that's Frank Harsant's salary, went up from £185,000 to £210,000 to £15,000. Now again, his trust says this was a one-off non-pensionable lump sum payment, which was given to buy out a performance-related pay element of his contract. And finally, the chief executive of Yeovil District Hospital, that's Paul Mears, started in May on a salary of between £155,000 and £60,000, when his predecessor was on £135,000. In a statement, the hospital points out his salary level reflects key responsibilities of the post. Now, none of these CEOs nor members of their remuneration committees were prepared to be interviewed, and neither was their representative body. That's called NHS Employers.
Our South West Pay Consortium are suggesting that staff should take a pay cut in their annual salary, work longer hours, have their annual leave reduced, sickness leave entitlement reduced and other terms and conditions, and yet at the same time these people, not just the chief executives but also their executive team, are receiving pay increases.
Of course, there is a competitive market for senior NHS bosses, but the message from the government to them seems to be pay rises will be closely scrutinised. Matthew Hill, BBC Points West, Yeovil.
The search for a